Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
And we're Smooth 98.1 Love Music, Love Life. It is a Smooth Drive, and this is to officially welcome you inside of Smooth Health on the Drive. Today, this Thursday, is brought to you by Evercare Hospital, Lekki. And my name is Judith TV.
I'm Kaide Baker. Today, we have a very, very, very special guest in the studio. We have Dr. Akidele. She's a consultant family physician, and of course, she was the pioneer of Triage Casualty Officer at the Accident and Emergency Unit of Lagos University Teaching Hospital in 2010. She also excelled in ensuring prompt assessment and resuscitation of numerous critically ill patients at the emergency department.
Dr. Akidele has special interest in geriatric care, skeletal health, and delivery of preventive and comprehensive health screening programs for all age groups. Dr. Akidele has attended several clinical courses, including the Advanced Life Support in Obstetric, as well as basic life support trainings. And she's here today as we're going to be discussing family medicine. Dr. Taye Patricia Akidele, welcome.
Thank you.
Good to have you here.
Good to have you today.
If you're out there, by the way, and you want to be a part of our conversation, well, you know what we always do here. We give out vouchers to the first 3 callers, courtesy Evercare Hospital. So please call us and be a part of, the show. Yes. Call the number 0144899981.
Absolutely. Also, you can send in your questions as well if you're not able to call us here in the studio. Our WhatsApp number is 0809-444-0981. Again, 0809-444-0981. So, Doctor, let's get started, shall we? So tell us, what is family medicine and how is it different from internal medicine?
Thank you very much. That's a very good question because family medicine is still relatively new in these climes. So family medicine is a medical specialty that provides continuous, coordinated and comprehensive health care to the individual and the family within the community. And this we do for all ages, all genders, all disease entities, people that have undifferentiated health complaints. They all come to the family physician. Now, how is this different from internal medicine? That's also very interesting because a lot of people feel, what's the difference between the two of them? So for us, I'll be grouping it in certain categories. First, about the demographics.
Okay.
The internist, that's the internal medicine physician, provides care for the adults with medical conditions. But the family medicine provides care for the adult and all members of his family. So that includes from the infants to the elderly. In fact, we say something like, we care for people from the cradle to the grave. So that's one difference between both specialties. Another important difference is that the location of providing care. An internist is basically located in the hospital or the clinic settings. But for a family physician, across all areas, across all locations, and the hospital, and the offices, and the outpatient clinics, which is where you usually will find us, and also in the comfort of your home, you can have your family doctor coming over to provide care for you. Another thing is the scope of services provided. The internist will provide in-depth care about complex medical conditions, but a family medicine physician will provide care for undifferentiated medical complaints, ranging from psychological issues to medical problems that as a result of family dynamics, because we as family physicians realize that there's a strong link between a dysfunctional family, for example, and their presentations in the hospital. Another thing is our strong love for preventive health. So a background, one of the fundamental principles in family medicine is that we see every opportunity with our patient, every encounter we have with them is seen as an opportunity for disease prevention and health promotion. So we're very big on preventive health because we know that we want the individual and the family to stay healthy, because we know that way we tend to avoid needless cost in healthcare, complications that can be avoided. So these and many more are a lot of differences between these two specialties. Another thing is that the family medicine is actually focused based on a social unit, and that's the family.
Okay.
So we see the individual, and we have training. We are provided with training to be able to care for every member of the family with all kinds of medical complaints that they may have.
All right, thank you very much for that. By the way, don't forget to get you those messages into 0809-444-0981. Also, I've got this question I'd like to ask you. The World Health Organization, they've affirmed that regular screenings for men and women, help in detecting symptoms of certain health conditions early, and also they allow for more treatment options. Now, in your opinion, what are some of the screenings and checkups that must be done, and how often, should they be?
Okay, I'd like to start by defining what health screening is. So health screening is a series of tests or physical exam or procedures that are done for a well individual. That is a person that does not have any disease. We call them asymptomatic individuals.
Okay.
And we do this for early detection of diseases. So for men and women, a lot of tests can be done to detect common chronic illnesses or non-communicable diseases that have been found to lead to comorbidities, complications, and early death, especially in this part of the world.
Okay.
In fact, that is one reason why Margaret Chan, who was the former DG of WHO, actually played a strong emphasis on preventing health, because they found out that 80% of non-communicable diseases are now found in low-income countries like ours. And we know with the poor health indices we have, poor funding, poor infrastructure, we must pay very strong attention to preventive health. So examples for men, we screen for prostate cancer for men.
Okay.
For women, we screen for cervical cancer, we screen for breast cancer, and also for cardiovascular diseases across all ages and sexes. We screen for things like hypertension, other heart diseases, diabetes, chronic respiratory diseases. Those are the few clinical conditions we screen for.
And they're all done at the same time or at different times?
It actually can be done at the same time.
Okay.
Yes.
All right. Like I mentioned, you can call the studio lines. We're giving out vouchers today, courtesy Evercare Hospital. We have Dr. Akidele with us in the studio. Taye Patricia Akidele. She's a family physician, of course, consultant family physician, and we're talking all about family medicine here. Let's move on.
We have a call here. Let's see who this is.
Hello. Good evening.
Hi, good evening.
Good evening, Gary. How are you doing today?
I'm very well, thank you.
All right, go ahead with your question. Fine, thank you. You've won yourself a voucher worth 10,000 naira courtesy Evercare Hospital. Go see your very first consultancy fee at Evercare Hospital.
All right, thank you.
All right, go ahead.
Go ahead with your question.
So, I want to ask the doctor, from the definition of family medicine that you just laid out, in essence, is she trying to say a family doctor is just like a personal doctor that the sole responsibility is to make sure the family is okay. So it doesn't have to wait till the family are undergoing or passing through any illness before the doctor acts. I want to get that clear.
All right, thank you so much for calling, Gary. We're going to get to your question real quick. You can also call us up here on 014489981. Again, 014489981. Doctor.
Yes, thank you, Gary. That means you're actually paying close attention to what I said. So like I said, family medicine, we are very big on preventive health.
Okay.
So that means you can actually see your doctor as a well patient. That means you don't have to be sick to access care by your family doctor. And yes, it's kind of like a personalized doctor for you and your family. Yes.
All right.
Nice.
Okay, let's move on real quick. Studies also have shown that people wait till, they fall sick before a visit to the hospital because, most people believe that their health will improve over time. So generally, can you walk us through this? What are the risk factors involved in this?
Okay, thank you once again. So there are a lot of factors involved in why people delay in accessing medical care. In fact, it may say that people delay in accessing medical care despite knowing they know that they do need it. And a lot of factors have been found a lot of research has been done in this aspect, and we found that one of the factors, I'm going to group them into two.
Okay.
The patient factors and then what I'll call the systemic factors. So for the patient factors, there's some psychological problems, like everybody has a fear of bad news. You don't want to get to the hospital and hear that I have this serious illness, this life-changing illness. All of us don't want to hear that.
No.
So that's one reason why people avoid going to the hospital. Another thing is people have had negative experiences in the hospital. Maybe they've been caregivers to loved ones who has had negative experience in the hospital, or they themselves have had previous negative experience in the hospital. So that's one reason they don't want that's kind of going back to that hospital, kind of like bring back those memories, and they don't want to experience similar situations. Another thing is funding. Insurance. Most people don't have insurance, and they feel, okay, if I go to the hospital, they're going to ask me to do this and do that, and I don't have the money for it. And also, people feel that, okay, the body has a natural way of healing itself. And I know that if I just wait, I take these smoothies, I take these herbal concoctions and all that, I'll be fine. And that is very rampant in our
society today.
In this society. So those are some of the patient factors. And for the systemic factors, long waiting time at the hospital, the hiccups you experience when you go to the hospital, the hassles, especially in the government hospitals, people want to avoid that. So also, people just feel, okay, the doctors just want to collect my money. They just want to do so many tests I don't need, and therefore I'm going to be wasting my money and time by going to the hospital. So those are some of the reasons why people avoid going to the hospitals.
All right.
We have messages here on our WhatsApp. You can be part of the show and send in your questions on 0809-444-0981. You can also call us up in the studio and you stand a chance to win 10,000 naira worth of voucher courtesy Evercare Hospital, and that goes to your very first consultancy at Evercare Hospital. So call us today on 01-448-9981. Again, 01-448-9981. We have a message here. This is Andy from Satellite Town, and it goes, how can we access the family medicine you talked about, considering Lagos and its hold-up? Please, I am interested in the prostate cancer screening. I am above 16. And we have another message here. This is IJ from Ikoyi, and she goes, what is the difference between a family physician and a general practitioner? And that's GP. Doctor.
Okay, I'll start with the second question. The difference between a family physician and a GP. I was actually expecting that question. Okay, so a family medicine, a family specialist is actually someone who has undergone specialist training. We also call them specialist generalists.
Okay. So
it's not just after that first degree of medical school. They've undergone the same number of years of postgraduate training as even an internist would go for, and to specialize in all differentiated medical conditions that people can be exposed to, and even to have hands-on experience, because your family physician can provide maternal health for you, can provide maternal care for you. Basic things, simple procedures can be done by your family physician. A GP, on the other hand, is a doctor that has finished his first degree in medicine and surgery, but has not gone ahead and done further training, has not had postgraduate training. But if you go outside Nigeria, people also refer to family physicians as general physicians. Okay. So I'm just trying to differentiate that for this part of the world.
So you're in a different clime. Let's say you're in the UK or other parts of Europe.
Yes, you call a GP.
Okay.
Yeah, definitely.
But and the work, like you mentioned, they're very similar, or
it's one and the same.
One and the same.
Yes.
All right.
So to tie my next question with Andy's question, besides just the prostate screening, what are some of the health screening packages that are available at Evercare Hospital, Lekki?
Okay, thank you. Back to the first question of someone who asks that is 60 years old and would want to do a prostate cancer screening. You can access that at Evercare Hospital. So aside the prostate cancer screening, we have a health assessment clinic that we run that provides about 4 packages. So both low and high income earners can access any of these packages. We have the basic, we have the intermediate, we have the comprehensive, we have the advanced. Also have other specialist wellness packages like a well woman clinic, a cardiac screening. So we have those packages. And what is common to all these packages is the fact that they are all based on evidence of those important diseases that we all need to screen for. So another thing that's unique to Evercare and the health assessment clinic is the fact that, as you know, we have an assembly of specialists. So if anything is discovered during your screening, you have a lot of specialists that are ready to provide care for you immediately. It's a one-stop shop where you can have specialist care at the same time you can have your screening done.
All right. If you just joined us, by the way, let's go on a quick break. This is Smooth 98.1. Smooth Health is what you're listening to. We're talking about family medicine today. And of course, our very special guest is Dr. Taye Patricia. She's a consultant family physician. Like we mentioned at the start of the show, we're giving out vouchers courtesy Evercare Hospital. And we'd like for you to reach out to us on social media, which is WhatsApp, or just call our studio lines 014489981. Or you can just send us a WhatsApp message 0809-444-0981.
Smooth Health on the Drive.
So Lagos, if you didn't know, now you know.
Stay tuned. For a smooth drive home and everything you like on your radio, we've got you covered.
Whatever I like, put it on my radio. If you wanna ride, just don't touch my radio.
All you ever need for that journey home.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
Listening to Smooth 98.1. Love music, love life, and you're welcome back. This is Smooth Health on the Drive. My name is Judith TV.
I'm Katie Baker.
And our special guest today is Dr. Taye Patricia Akidele. She is a consultant family physician at Evercare Hospital. And of course, Smooth Health on the Drive is sponsored by Evercare Hospital, Lekki. Now, before the break, we were talking about health screening, family medicine, and all that in between. But first, to remind you that we are giving out free vouchers worth 10,000 naira, courtesy our sponsors, Evercare Hospital, Lekki. That voucher goes to your very first consultancy at Evercare Hospital, Lekki, and they are promising to bring global healthcare, world-class standard to your doorstep. So avail yourself today. If you have any questions for our doctor concerning family medicine and everything else, please call us up today on 01-448-9981. Again, 01-448-9981. Send us a WhatsApp message if you cannot call us, if you don't want us to hear your beautiful voices, on 0809-444-0981. Again, 0809-444-0981.
So, doctor, let's talk about benefits of screening, right? So, I mean, in your opinion, what are the benefits of regular screening, and also, are there any risks to it? And I say risks to it in a sense that, some people feel like when they get under an MRI machine, they'll be like, this thing is radioactive. They will be fried. Other things related. So what are the benefits, and then what are the risks?
Thank you once again. So benefits of health screening. Number one, like we have mentioned, we have the opportunity to detect early diseases at their early phases, at their asymptomatic phase. I mean, the phase where you can be treated and most likely have a cure. Or another thing is that we are able to avoid getting complications. So the diseases are getting treated, you are able to monitor for complications. Then you are aware of your health status. You get to be aware of what exactly are the things I'm supposed to be monitoring. For example, okay, I'm supposed to be doing my monthly self-exams for breast. I'm supposed to be checking up with my breast clinically every year. Yeah, well, okay, this was found during my screening and I'm supposed to monitor it. So it's not all about maybe just treatment. It might just be something to monitor. Another thing is that it improves quality of life, because it's an opportunity to provide, like I said, disease prevention counseling, what we call lifestyle modification counseling. We're able to say, okay, you don't have any, your health screening went fine, but you have so and so risk factors. And these are the things you have. Poor health risk factors. Maybe you have hereditary diseases
or
exactly.
traits.
Exactly. So there are things that you need to really watch out for. These are things that you must knock off the other risk factors like environmental factors and all that, dietary factors and all that. So those are some of the benefits of screening. Another thing is that, so for the risks associated with screening, yes, we can have overdiagnosis. We can have over-treatment. You can have.
I'm glad you said overdiagnosis because I was going to say miss, but then you said overdiagnosis.
Yes,
so that
because there are some diseases that they're just there. They're not going to cause any problems. But when you over-screen, that's why it's very important. It's very important to know where to go for screening, because a lot of people have packages that are not really based on science. They're not evidence-based. It's not just every disease that we screen for. There are diseases that we know that, okay, they are going to lead to chronic illnesses. They must be gotten at their early phases, and they're gotten their treatment for it.
For example,
but you just find
can you give us an example of such?
Okay, for example, someone that has maybe some enlargement of his prostate, and all this, the test, the PSA was normal, and the doctor can just say, okay, you need to get out of the prostate and all that. So it can lead to over-screening, can lead to over-diagnosis, can lead to over-treatment. And there are some other things. You could just find maybe something in the spine, and everything was fine. Person is fine, is working well, no pain, and then that's more exposure to radiation, more tests done, needless treatment. So those are examples. So another thing you can have is false positive results. For example, that means that the test says you have this disease, but actually you don't. And of course, that will lead to anxiety, and then treatment for what you actually don't need. Then more evaluation, more cost involved. Well, and at the end of the day, just find out, okay, they said I didn't have it. You have gone to 2-3 places, you've been worried and all that. So those are the...
In cases like this, it's, if you've been to a hospital and they tell you this and that, would you advise always getting a second opinion?
Definitely. That's why sometimes when we pick up some results, we don't just start treatment on those results. We need to go for recheck, confirm these things before just going ahead and starting treatment.
All right, this is Smooth Health on the Drive, brought to you by Evercare Hospital. Our doctor here today is Dr. Taye Patricia Akidele. She's a consultant family physician with Evercare Hospital, our sponsors today. And we're talking about family medicine. To be part of the show, call us up on 014489981. Again, 014489981. Send us your questions if you have any question for our doctor today on 0809444091. Please do not send us a text message. Send us a WhatsApp message to 0809444091. Doctor, this may be the most important question today. It is, how important is it to have a family doctor?
It is so important to have a family doctor, because one of the things a family doctor has is it has your entire medical history, and that can run across generations. So, for example, you have a family of 3 generations. The family physician is aware of what the first generation has, and is looking out
problems.
for and it's looking for red flags, and may even provide, okay, you need to have this genetic counseling based on what has gone ahead. So that's one of the most important reasons why you should have a family doctor. Another thing is that your family doctor is your advocate before other specialists. Is able to coordinate your care across specialists, able to speak for you amongst the specialists, amongst those allied professionals, and it kind of like stands in the gap sort of for you in the health system and helps you to navigate the chaotic health system, usually what we have in Nigeria. So that's one of the things. And then your family physician is your friend. You don't have to come when you are ill. You can come. We have elderly people. That's why I'm actually someone who is really in love with elderly people. They just come and they just want to talk to you, and that makes their day.
Yes.
So it's your friend. It's not. Able to even we have situations. Yeah, exactly. You have a relationship with your family doctor. We have situations whereby the patient has come to the hospital with this condition, and everybody's doing so many tests running all over the place. Meanwhile, it's just caused by a family dysfunction. And then we have things we call family conferencing. We talk to the family, and then patient is fine. Meanwhile, has been using so many drugs, and all he had to do was just talk to someone. Yes, and then you have meeting with the family, and then you hear sort of things, and then, okay, this is why I've been having these chronic headaches, which could have been avoided. So that's one of the most important reason why you should have a family doctor, and of course the preventive help, like I said.
So would you say that I mean, here in Nigeria, there are a lot of people or a lot of families that have family doctors, because most people, tend to look toward general practitioners as opposed to family doctors. So would you say there are a lot of families that have family doctors? And then also, what advice would you give, regular people concerning family doctors?
Before we answer that question, let's also take this call as well. Hello?
Hello. Good evening.
Good evening.
Yeah, the Andy that gave you the text message.
Okay, Andy, good evening.
Yeah. Considering your location, would it be so difficult for one to make satellite to Lekki, this whole dog time and all the while?
Okay, thank you. Yes, you're definitely correct. So we also, at Evercare, we also have a provision for telehealth. So meaning you can have a consultation with your doctor via just by video conferencing. So you can actually access that service if it's difficult for you to come over to the hospital physically.
Oh,
Andy, so did you get that?
So I hope Andy you got that. So there's also telemedicine, all thanks to Evercare Hospital.
So we're talking about family medicine, right? And I'm talking about how,
access to family, just family doctors. Do you see a rise in that? Nigerian families like leaning towards having more family doctors, or they just go to general practitioners? Or do you think it's going to change? Is that trend going to change anytime soon, giving our health terrain?
I'm actually hoping that will change very soon. Right now, we don't have so much of that going on. We just have people walking to the hospital when they have one illness or the other and go. I think the old generation families still have their family doctors. But for the newer generation, we don't see that as a trend. And I'm hoping that will change with more exposure, more realization that a family doctor is actually one of the most important persons in your life. Let me put it that way.
Yeah.
All right, real quick though, let's circle back for those who just joined the show. By the way, this is Smooth Health, and of course it's brought to you by Evercare Hospital. But let's see who this is. Hello, good evening.
Hi, good evening.
Good evening.
Good evening. What's your name?
My name is Emmanuel. Hi.
Emmanuel.
Where are you calling from?
I'm calling from Lagos.
All right.
I was calling this number because I had the number on the radio, and they offered the opportunity to call in to ask questions on the.
Ask away.
Yes. Right. I was wondering. I hear about all the other services that are provided, but I was wondering if there are dental services as well.
All right. Thank you so much.
Evercare Hospital.
Emmanuel, thank you for your question. The doctor, are there dental services?
Yes, definitely. We have dental services. We have a world-class dental clinic. We have a visiting dentist that is always around, and you can access this service. Yes.
George is asking, which HMO are you affiliated with? Well, quite a number of them, if I would add.
We have quite a number of HMOs that use Evercare at the moment. So you can just liaise with your HMO and find out whether Evercare is one of the hospitals that they use.
All right.
Real quick though, let's circle back and ask this question, because I think it's very important that people should know this. Like I mentioned, according to the World Health Organization, they've affirmed that regular screenings for men and women help in detecting symptoms of certain health conditions, and they also allow for treatment options. So, like I mentioned, what are some of the screenings and checkups that must be done, and also how often should they be done?
Okay, I want to start by saying all ages can actually have health screening. For example, newborns have particular health screening that they should have, and then even pupils, children can have actually their eyes, their ears. You must find out that they have good vision, they're able to hear well and all that. So it depends on the age, and then depends on what the issues are. So for men and women, we're talking about the adult population.
Yes.
Okay, so we want to screen for hypertension, we want to screen for high cholesterol levels, which is what we call dyslipidemia. We want to screen for cancers. The common cancers in men are prostate, lung cancer. We want to screen in women, we want to screen for cervical cancer, we want to screen for
breast cancer,
and also for respiratory diseases as well. And also in the elderly, it's important that we're screening for the risk of falls. So we want to be sure that their eyesight are good. We want to check their hearing. We want to check their bones as well. Be sure that they don't have any weakness in bones that can cause them to fall and break their bones. So that's some of the screenings there are a lot of screenings that we do, but those are some of them, like I mentioned, at the at a glance, yes.
Well, Doctor, thank you so much for coming. You've been quite helpful when it comes to looking at our health and just maybe family medicine and just getting a family
looking
doctor.
At it in a different perspective.
Exactly, might be the way. But Doctor, before we let you go, how can we get in touch with Evercare Hospital and yourself as well?
Okay, so to get in touch with Evercare Hospital, our location is number 1 Admiralty Way, or Bisola Drosimi Eti Drive, Lekki Peninsula Scheme 1, Lekki, Lagos. And then you can call us on 081 39 850 710 or send an email at info@evercare.ng.
All right.
And also you can always send me a mail at taye.akidele@evercare.ng.
Taye Akidele. So that's A-K-I Dele. There's no N in Akidele.
Exactly.
I like the way you said Akidele,
yeah,
right?
Akidele.
Yes. I had a joke about that when we want to start the show.
Akidele at evercare.ng. So make sure to reach out to them. It's www.evercare.ng. The telephone number is 0813-985-0710. That's 0813-985-0710. Email them on info@evercare.ng. Again, info@evercare.ng. The address is 1 Admiralty Way, Bisola Drotimi Eti Drive, Lekki, Phase 1, Lekki, Lagos. Doctor, thank you so much.
All right, Lagos, there is more to come. If you're out there and you're looking to have a great time still, this is Smooth 98.1. Wait till 9. Thank you so much, Doctor, once again.
Thank you very much.
Thank you.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness
Every
of cancer.
Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.